My name is Nathan Martinez, and I'll be covering STDs in the gay community. The acronym STD stands for sexually transmitted diseases, and they are diseases that are passed on from the contact of one person who tested positive to another during forms of sexual activity, which include oral, anal, vaginal, as well as skin-to-skin contact in the genital area. While this regards everyone, the LGBTQ plus community is affected significantly more than heterosexual individuals. This is a public health concern because gay individuals are most at risk of having these diseases, factoring that they statistically show higher rates of infection. Again, all these diseases are contracted through sexual intercourse with infected individuals. Human immunodeficiency virus, or HIV, could also be contracted by using contaminated needles. Their symptoms include headaches, difficulty swallowing, fever, night sweats, fatigue, appetite, and weight loss. And there's no current treatment for a cure. However, with current medication, it can be attainable to control and live with. Chlamydia is the most common type of bacterial disease, most prevalently in ages 15 through 19. The symptoms for men and women involve discharge in genitals and moderate pain while peeing. And most of the time it goes undiagnosed because the possibility that its positive detection could lack no symptoms at all. Treatment is available and there's a cure. Gonorrhea is a bacterial disease, and their symptoms include for males, discharge in the penis and painful burning sensation while peeing. And for females, it's painful burning sensations while peeing and stomach pain, as well as a few more attributes. There's a treatment and there's a cure. And for syphilis, doctors divide these diseases into three types. The primary, which is the development of canker seen in genital areas and mouth. Secondary, where rash develops on skin, sores in genitals, fever, cough, weight loss due to suppressed appetite. And lastly, the tertiary, which is the presence of syphilis in multiple organs, which causes failure. There is treatment available, however, if not taken soon after exposure, can cause fatalities. For HIV, you will see an upward shift of cases from 2000 to 2007, which reached its highest peak of 48,000 people, most prevalently in the LGBTQ community in 2011, then start to decrease. Lastly, you see new infections slowly decrease as years go by. For chlamydia, it shows a peak of 1,808,703 cases. The cases correspond to the amount of cases per 100,000 people in the area. As you can see, in 2014 to 2019, men show a higher increase than women. The higher increase is due to the high rate of exposure to the male-to-male category. For gonorrhea, you will see a peak number of cases in 2019 of 616,392 people. In men, there was a 60.6% increase, and females only 43%. The STD surveillance network shows that a significant percentage of males were in the gay community category, about 42 times the rate of the heterosexual individuals. And lastly, syphilis shows an overwhelmingly increase in cases. In 2019, had its peak of 129,813 cases. With this graph, LGBTQ males contributed 59.7% of infected males in total. There's always a possibility for contraction, and a few of them include unprotected sex, which is the absence of a condom, and age. People under the age of 25 are more likely to have the disease due to taking risks in their sex lives. Having multiple partners. People who have multiple partners are more susceptible to diseases due to the transmission of multiple partners, germs, and other people. Recreational and drug use, and considering that drugs and alcohol alters the brain's ability to think clearly, an individual could be less aware and have risky sexual intercourse. My recommendation to lower the risk and to decrease the public health issue, I advise schools to add sexual health classes as part of their curriculum within all stages of schooling. The repetitive teachings will render the students to stay aware and current to sexually transmitted disease trends. In class, our chapter 10 PowerPoint displays that in the case of getting infected with diseases such as HIV, professionals advise getting treatment as soon as possible. Highly active antiretroviral therapy or HAART provides treatment that helps infected people lessen their viral cells to undetectable levels to shorten the chance of transferring diseases to other people. Thank you so much.